Hello, dear viewers. Today on Aspire32, I have a special guest, and he has been inspiring me and all of us. He doesn't need an introduction because he is someone who is synonymous with the word dental photography in India. And trust me, when I was new in this field of dental photography, it was Dr. Mayur Davda who is today on our podcast. He is here to inspire us with all his knowledge and his experience about dental photography. He has been speaker at national, international level. He has been a Canon Photomentor, and the list is really big. But it is a privilege to have him on this Aspire 32 podcast today because this podcast is to inspire those young viewers of Aspire 32 who find it difficult to orient themselves to dental photography. And today I am here discussing his journey, Dr. Mayur Davda's journey in dental photography. And we'll try to know how this journey started, and that's how he has excelled in this field. And I'm sure that that will inspire all of us. Welcome to Aspire 32, Dr. Mayur Davda. It's a great pleasure to have you on this channel.
Oh, it's absolutely my pleasure, and thank you so much for inviting me over. I take inspiration from you the same way that you take tips from me. In fact, when I met you for the first time in Delhi, I suppose I can't remember what conference that was, but we were actually roommates, if you remember. And at that time, we barely knew each other. From that particular date till today, even your journey and my journey, both our growth has been quite logarithmic, and I'm very happy to see where you are, where your YouTube channel and the way your podcast is growing. It's been an awesome journey, and from the
Thank
point where we met till the point where we are right now, I'm
Yes.
very happy to see
And
your
I think
growth
we
as
are
it
we are
is.
in the similar boat because you have your podcast.
I'm happy it's just being helpful, and that's the actual motive of the 32-minute podcast, which is just to speak to awesome people and learn from them. Actually, that's the reason why I started the podcast, because somewhere in the journey of teaching dental photography, I realized that my growth as a dentist is also being hampered to quite a large extent. And a major chunk of my time, which was supposed to be invested on learning, was actually going in teaching only. And one very exciting way to learn would be by speaking to the best speakers of the world. And that's the actual reason why I started the podcast. So I can connect with awesome people like you, and learn from them. And for people who don't know, the 32-minute podcast was launched with a live event that was on the 24th and 25th of October. And because Dr. Suresh is such an inspiration for YouTube, he was actually one of the speakers in the launch of the 32-minute podcast. So
That's very important, sir. And I want to know because you said and your experience clearly, it's quite similar to what I have. That we get so busy in this practice and one way of teaching. But I want to know that you have excelled in dental photography. There is no doubt. You are the best. But I'm sure you started somewhere as a student, and all of us know Dr. Mayur, who is an expert in dental photography. But personally, or many of us, we don't know how you started this journey in dental photography. So I want to know first, who was your true inspiration for starting this journey in this dental photography as a beginner?
I started pursuing dental photography 13 years back. And very honestly, there was nobody to guide anyone. So I had no mentors, to be very honest, and I had to learn everything on my own. So I purchased my first DSLR after 2 years of investment because I did not have enough money, and which I believe is the same story with most of the students even today. Nothing has changed when it comes to investing money on a camera for documentation. The priorities of everyone are different. Even for me, obviously, it was investing on different things like a mobile phone. But when you actually enter into private practice, you also want to improve your skills, and that's the reason why I invested on a DSLR. So before actually starting my journey with a DSLR, Also, I was taking a lot of pictures with a point and shoot camera, but obviously the ultimate was a DSLR. So I saved money after 2 years, and I bought my first DSLR, which was Canon 600D. And I remember I had a friend who's actually a photographer, Samir, who actually taught me photography, but obviously that was general photography, and it was up to myself to how do I go about implementing those general photography rules into dental photography. So I started playing with the settings myself and learned the entire process by myself. But it was a very exciting journey, and I'm pretty tech savvy, so obviously enjoy playing with equipments. And I thoroughly enjoyed using my Canon 600D at that particular time. And I also started pursuing wildlife photography, and I started doing butterfly photography, recording butterflies, life cycles, and stuff like that. And I got really good at it. But even for butterflies, you require something called as a macro lens. And obviously, I did not have money to buy a macro lens at that time. So for getting a macro lens again, I had to wait for 2 more years so that I could do good butterfly photography, recording their pupae, recording the larva and stuff like that. So I had to wait for 2 more years for investing on a 100 macro lens. But the mistake that I made was I always wanted the best equipment. For example, even the 100 macro lens, I wanted the best lens, the expensive lens. So I had to waste a lot of time for investing on the best equipment. But little did I know that the best macro lens, that's the expensive one, is not that good for dental photography. So, in the process of doing general photography, I actually picked up on dental photography as a parallel. So, I was enjoying general photography, but I learned dental photography out of enjoying my general photography. You can say, particularly general macro photography. So, I used to do
But
macro
was it
photography with
was this
50 to 55.
was this when you were a student, or this was
No, this was
after?
after passing out. This
Okay,
was after
I
passing
want
out.
to
It
know,
was
sir,
after passing
here,
out.
because I'm sure there is a lot of information. But how much was that total initial amount which you had spent at the beginning as a student to buy these
Uh,
equipments?
as a student, I never had any equipment. Very honestly, I was not so aware that documentation is important. I wasn't so fortunate to connect with the right people who would actually tell me that during the student life, documentation was important. Right now, the world is open, social media and all, you pick up a lot. But at that time, social media was not so powerful. The only actual social media was Orkut at that time, and people never spoke about documentation
Yes,
at that particular
yes,
time. Yeah.
yeah.
So, yeah, as a student, I never had any documentation interest. It was
Mhm.
just general photography with my phone. The only documentation that I did was recording oral pathology slides through my mobile phone, through the microscope, so that I could remember them during my exams. Have you ever done that? A
We
lot of
did,
students do that.
but I'm really not sure. I never had a good mobile phone during my undergraduate days. Also, in fact,
Mm-hmm.
we never had a good mobile even in my post graduation.
Yeah, I think cell phone cameras came when I was in the third year or maybe something like that.
Yeah.
And the first thing that I did was stick it to the this microscope, the oral pathology microscope, and
Yeah.
record all the slides so that I have a record of all the slides and I don't remember them. So actually, you can say yes, that was a kind of documentation. So I started off with a mobile phone stuck to my microscope, opath microscope. Yeah, that documentation I did.
There is one important point, sir, which I'm really wondering. I'm really not sure how the dentistry works in the different part of the world. I know the India also, we do give good quality treatment to people who cannot afford it. But there is one thing which you are lacking is the documentation, and you are the most important person whom I have been following, who gives importance to the documentation, and many of us, we don't value it. Why is that the dentist do not value documentation in their practice? I'm sure you are quite busy. You have been practicing dentistry in Mumbai for many years. Why is that others do not value documentation as much as you do?
Okay, so I've been teaching dental photography since quite a lot of years. So I do know quite a lot about other people's experience. And when I give a general lecture to a crowd of 200 people, 300 people, sometimes even 1,000 people in the room, I do come to know about different opinions why people don't pursue dental photography, if that's the question that you're asking. Uh, One of the main reasons is some of the dentists have a roaring practice, like a mass practice, and they have an OPD of 70 to 80 patients in a day. So obviously they do not have that kind of an attitude to actually, very sorry to say, but document and improve. Your improvement is only going to happen when you see the kind of cases that you're doing. But when somebody is doing 70 to 80 patients in a day, I don't think they are going to have time to even think about taking the phone in their hand or taking the DSLR in their hand to document the cases. They just call the patient, do something, and then send them back. And in fact, I'm sure in conservative and endodontics department, in most of the colleges in India, that's the same situation. There are too many patients, and nobody's going to have time to document cases. You need to find and figure out time so that you can document your good cases at least, which is something very difficult in a roaring practice. Now, some of the other reasons why people don't document is that people think that it's a little complicated with a DSLR, so they don't want to invest on a DSLR because of two reasons. They think that it's complicated and they think that it's expensive. Both of the reasons are wrong, because DSLRs, once you buy, it's going to be lasting you for your life, and it's really not very complicated. People think it's complicated because there are a lot of buttons. But I want you to ask yourself one question if you're listening to this podcast. If you have a TV, it has a remote control. Your remote control has all the buttons that you can use, possibly use to control your TV. But does that mean that you have to use all the buttons on the remote control? Absolutely no. Maximum you'll be using one or two buttons, and that's exactly what we do in a DSLR. Although it looks pretty intimidating, we don't have any reason to use all the buttons. So it's DSLR is very simple, but people think otherwise. So these are a couple of reasons why I feel people don't document their cases. And obviously, they think that by doing a course and stuff like that, like for doing good endodontic treatment, if they just do a course, it's going to be helpful, or just learning good composites, they can do a good job. But very honestly, doing a course is important, yes, but you need to follow up on how you're doing your cases, which is possible only if you document your particular case, because you're not going to remember over a period of time how you did a particular case, and you need something to look back to. For example, if I've done a particular case, I'm not going to be remembering how was the anatomy forever. I'll probably remember it for 7 days. After that, I'll probably forget it. But if I have pictures of that particular case, I'm definitely going to remember. So I think that kind of a push is kind of lacking. And obviously, another reason is nobody's being taught dental photography during the graduation. So, yeah.
So if somebody wants to start a dental photography, what do you think are the main essential equipments he can have? How much would be the basic investment he would have to do for dental photography?
So dental photography has different levels. If and it obviously depends upon how good you want to do. If you want to be the best, you need to have a good DSLR, 100 macro lens, and a flash. That would be the best, and that's very fast as well. So with the equipment that I'm saying, like basic DSLR, like a Canon 1500D or Canon 700D, excuse me, a basic equipment like Canon 700D or Canon 1500D, that would be around 25,000 rupees Indian. A 100 macro lens would be around 40,000 Indian rupees, and a ring flash would be a third party ring flash would be 10,000 rupees maybe. And if you actually want to go for the best, that's Canon, that would be around 35,000 rupees. So if you actually see, if you have that kind of money, go ahead for the best. But if you don't have that kind of money, I mean, for students who might be listening right now, don't stop yourself thinking that it's expensive. Start with whatever you have. I'm sure everybody has a phone, so you can obviously start off with anything that you have and then probably grow up after that. But one thing that I would definitely want you to invest upon would be good intraoral accessories. Please do not use mouth mirrors for documenting cases, because that not only looks ugly, that looks stupid. Um,
So what
and
exactly
by
they should have, sir? Like, can you give us
they
any
should
idea?
definitely have a full arch occlusal mirror, that is a stainless steel mirror, because they are cheap and long lasting. They are rigid. Then they should have quadrant mirrors. It's actually called sectional mirrors. They are not broad mirrors, they are narrow mirrors. And I'm sure you'll agree that 90% of the dentistry that we do is mostly not a full arch case. It's mostly a quadrant kind of a case. So for that, it's totally stupid to use a full arch occlusal mirror. Just use slender mirrors. They're called quadrant mirrors or sectional mirrors. It's a must have to have those kind of mirrors. Just ensure that you have a contraangled sectional mirror. That's one of the most important equipments. So that's available online on delphotographyschool.in. And one more investment that you should do is contraster. If you are doing anterior aesthetic cases, please buy that. And definitely different cheek retractors. People think that just with the normal cheek retractors they can manage everything, but trust me, that's not the case. You need to have C-shaped cheek retractors for maximum intercuspation position. Means when you're recording both the arches, which is not really important for an endodontist. An endodontist should have quadrant cheek retractors, that is just retract the first quadrant or just retract the third quadrant or stuff like that. Because when you put big cheek retractors, the patient's not going to be giving you so much of a mouth opening, and if the patient's mouth opening is not good, that's going to reflect on poor images. So if you want good images, see to it that you do minimum but adequate retraction. That's minimum requirement. And a good quadrant mirror, or a good sectional mirror. And after these two are in proper place, you can go ahead and use any kind of photography equipment that you have. If you don't have money, at least use your phone. If you have money, at least have a Canon DSLR with 1855 lens initially is fine. Like I did documentation with an 1855 lens for at least 2 years of my life. Then somewhere down the line, I purchased a 100 macro lens, used it with inbuilt flash for 2 more years. And then I went ahead and bought a twin flash, which I was wrong again. But the workhorse is a ring flash and not a twin flash. Twin flash is just needed for anti-aesthetic cases. So depending upon what stage you are with respect to how big your pocket is, of anything is fine, but please have good intraoral accessories. I would suggest that you have at least two sets of good intraoral accessories for documenting your cases.
Okay. So,
Yeah.
sir, then in this also, I do feel that you mention Canon cameras. Just out of
Yeah.
curiosity, that if somebody is confused between the Nikon and Canon, which one
Hmm.
should be a better choice for intro photography, and why is that?
So most of the people think that it's about image quality, and the answer to that is it's totally nothing about image quality. Any DSLR that you use is going to give you great image quality. The reason why I say this Canon is because of practical reasons. One of the most important things that you need to have for good documentation is a lightweight equipment. All right, so that's a general rule. If your equipment is light, you're going to be more comfortable, and your documentation is going to be great. If you want your equipment to be light and weight, so Canon and Nikon both make great basic cameras which are light and weight. So that's agreed upon. But the problem does not come here. The problem comes with the lenses. For a good dental intraoral photograph, you're required to have a macro lens in the range of a focal length which is 85 to 105. So I'm not going to go into the details of what focal length means, but we want something called as a 100 macro lens or an 85 macro lens for dental photography. So that's understood. But the problem with Nikon is that it does not make a lens without image stabilization or without vibration reduction. So, what is vibration reduction or image stabilization? It's basically a motor or a gyroscope which is inside the lens, which prevents the shake. It does not prevent the shake, it just um, counters the shake that you have with your hands. If you shake a lot while recording pictures, it'll counter that. But we need to understand that this kind of technology is required for non-flash photography. It's not required for flash photography. So dental photography is actually flash photography, and hence image stabilization or vibration reduction is actually not required at all. In fact, if you have it, you have to put it off because it really irritates when recording a picture because it makes a weird sound and it takes some time to focus as well. So it's understood that for dental photography, we need to have a lens without image stabilization or vibration reduction. And that's where Nikon is lagging behind. It does not make a lens without vibration reduction or image stabilization, which makes its lens very heavy as compared to the Canon's lens. So ultimately the entire equipment weight will increase and that becomes much more uncomfortable. The other reason is Nikon does not make a ring flash. Canon makes a ring flash. Obviously I would probably want to invest on a company which makes everything, camera, lens, as well as the flash of its own. So Nikon does not make a ring flash. It makes a twin flash, but it's a very complicated twin flash as compared to a Canon's twin flash. One more thing is that its twin flash works on a special type of a battery, that's CR123, which is very difficult to procure even in cities like Mumbai. Whereas Canon's flash works on a AA battery, which you know that it's available everywhere, and you can just put Duracell also if you fall short of rechargeable options. So a lot of advantages, but the most basic advantage is that Canon is much more user friendly and easier to learn as compared to Nikon. That's a very subjective comment. There are a couple of people who have been using Nikon and they're comfortable with it, but this is not about comfort or image quality. This is about practicality, and the practicality is Canon's equipment is way more lighter as compared to Nikon's, and the batteries that a Canon's flash works on is AA, which is easily available as compared to the twin flash of Nikon, which is CR123, which is not very easily available. So it's kind of a tricky situation. Nikon's twin flash is also very difficult to use.
But one thing, Dr. Mayur, I want to know here is that if you want to do if somebody wants to document a composite restoration case in anterior teeth,
Yeah.
how much time do you think someone has to devote? Because when somebody asks anyone who is a beginner in dental photography, they always tell that, yeah, usme, it takes a lot of time, and they give up. They give up at that
Always.
situation. But
Yeah.
how
Yeah.
much time a skilled person, eventually a person who keeps on doing it, will, for example, like rubber dam initially is really difficult, but as you keep on practicing, at the end it takes very less time. So in
Hmm.
dental
Hmm.
photography, a skilled person, if you want to document one single tooth restoration procedure, how much time do you think will be required?
I take 3 seconds to record any particular shot, irrespective of what shot it is, whether it's a quadrant image or composite. It does not matter. 3 seconds, and the rule remains the same for anybody who's joining my workshop. So I have seen that growth or the transformation. So when I ask my students who are joining my workshop for the first time, I ask them to record a particular shot, and they take like forever to record that particular shot. Maybe it could be 5 minutes, 10 minutes, 15 minutes, and even that image is not accurate. But by the end of the second day, they take that same particular shot in less than 3 seconds. So it just requires 48 hours to take a good shot that's in 3 seconds. But that's the time that you need to invest. You need to at least uh, come to a particular workshop and learn how to do it properly, and then I'm sure you can do it for any image in less than 3 seconds. So any image can be shot in around 3 seconds, that's for sure. But you need to invest around 24 to 48 hours to learn how to reach that particular stage. But it's a very simple journey, just 48 hours of learning and you're through it. I'm not talking about 48 hours throughout learning. So you can learn that in 12 hours split into 2 days, and I'm sure you can do it. But this is for one image. But usually whenever you have a good case, you cannot go ahead with a single image, right? I'm sure you agree that if you want to publish in a journal, one image is not going to help. You need to record a protocol. So typically an anti-aesthetic protocol would have 12 images, because we follow the AACD protocol. For people who don't know what that is, just google it. What is an AACD protocol? It'll say that it has 12 pictures, and you can actually find out online itself what are those 12 pictures. So 12 pictures multiplied by, you can say, if not 3 seconds, 3 minutes. So that's the minimum amount of time to record a full case as such. But 3 minutes is just too long. You should actually get your image, if not in 3 seconds, in 1 minute at least.
So do you train your staff in your clinic to help you out with this? Or do you think that a single person can do everything in dental
Okay.
photography?
Very honestly, I do not tell my staff to help me when I'm doing a particular case. I've seen a lot of dentists asking the staff to hold the mirror, and that's not how it works. Because what the staff is seeing through the mirror and what a dentist is seeing through the mirror is definitely very different, because of something called as a parallax effect, because of different positions. So your staff can definitely not help you with holding mirrors or stuff like that, but they can definitely help you with cheek retraction, because sometimes the patients don't retract properly. But I prefer not that kind of an help also, because they block a lot of space around the patient, and I don't prefer that. I frequently request my patients to hold the cheek retractors. If they are not able to hold it properly, I ask my staff to come into the picture and hold it. And because they've been seeing me doing dental photography for quite some time, they got trained obviously on their own. But I would suggest that the person who's documenting should be holding the mirror and the camera both. And the person who's having a camera but the staff is holding the mirror, they are never going to get accurate pictures.
But sir, I had another one question. Is that the mobile phones are nowadays have three camera, four camera, so much of information, so much of technology. Do you think they can replace DSLR for dental photography?
Whenever we are comparing a phone and a DSLR, most of the people think in terms of image quality and that's not the reason why we don't use a phone. So maybe I can say today we have mobile phones which have 48 megapixel and all, and there are DSLRs which have just 18 megapixel. So but that's not the reason why we don't use a phone. The reason why we don't use a phone is because of a lot of other reasons. There are, we can say, three or four typical reasons why we don't use a phone. One of them is asepsis. I carry my phone everywhere. I even carry it to the washroom, and obviously I don't want to use that particular phone in my operatory when I'm seeing a particular patient. The other reason is when I'm documenting a particular case. If you're in college and all, it's fine. I'm sure your patients in college and all, they're not going to be thinking about you, or they're not going to be judging you. But when you're in a private practice, the patients do think a lot even after they've left the clinic. And when they're going back home, I don't want them to think that, oh, my dentist documented the entire case with a mobile phone. That's really cheap. So it's kind of insulting in a particular way, and it's very negative of an image that the patients could perceive of us. So this is one very important reason that the students don't really have to worry upon if they're in college, but dental practitioners definitely have to think because it looks really horrible. The other reasons are the lens that you have in your mobile phones. They are typically wide angle lenses, and they give a lot of distortion when it comes to documenting the intraoral pictures. So this is particularly perceivable if somebody's taking a selfie. They definitely do not keep the phone very close to the face because the nose looks very big. So wide angle lens typically has the tendency to um, enlarge the particular subject that's very close to the lens. And so your nose will look very big, but the things which are farther away from the lens, like your eyes or the ears, they're going to look very, very small. So in dental photography and documentation, we don't want distortion to happen. So that's one of the reasons why we should not be using a phone. But again, there could be a counter argument that there are phones which have the zoom these days. So can we zoom and all? Yes, you can. That's going to be taking care of distortion to some extent, but definitely there will be some kind of a distortion. Other reasons are the sensor of the mobile phone is very bad as compared to the sensor, which is the most important thing. But the ultimate reason why we don't use a phone is because of standardization. So dental photography is not about taking a particular image. Like, it's not about one image. I'm sure you understand that. So you cannot finish your documentation just by recording a pre-operative image. You need to have a series of pictures, right? So it's pre-operative, maybe three or four operative pictures, and then you have a post-operative picture. The challenge with the mobile phone is all these three pictures are not going to look same because you don't know where to stand, how much to zoom, and then take a picture because you don't have a standard for that. In DSLRs, which with a macro lens, you actually have a standard for that, and you exactly know how far you're standing from the subject exactly. Like you know exactly that you're standing at a distance of 1 foot away because that's written on the lens, or maybe 5 feet away. So you always set it on the macro lens that I want to be standing at 1 foot away from the subject or 6 inches away from the subject for anti-aesthetic cases, and then take a shot. So standardization is probably the most important reason why I prefer DSLRs, because that kind of makes sure that I'm always standing at the same distance from the subject while recording the entire case, pre-operative, all operative, and maybe even follow up after a year or two. I exactly know where to stand, which I obviously I'm not going to remember if it's a mobile phone. I'm going to be forgetting it after 6 months how close I stood from the patient or what zoom I used for that particular case, which is a challenge when it comes to mobile phone. Another thing is obviously the depth of field, which probably I don't think I should be talking about because it requires some amount of understanding of photography. But DSLRs have something called as an F number setting, and I'm sure you know about it, but I'm not really sure if the audience that's listening to us knows about the depth of field or F number. But that's something that we can control in a DSLR. We typically use f of 22 and above for intraoral photography, which is not possible with the mobile phones, and that's why the images don't look entirely sharp. So mobile phones are made for good portrait photography, blurring of background, that all is fantastic. But when it comes to documenting your cases, a blurring is not really considered gold standard.
I have one more question, sir. Whether I'm really not sure whether it's a suitable question, but people do ask that if the dental photography is going to take more time, does that mean you will have to charge more for the patient?
That's a great question. Very honestly, I think I'm doing dental photography for myself and not the patient because I want to improve. And I don't think I'm going to be charging for improving myself to the patient. That's very, I mean, I don't think that's the way it is. Uh, I mean, it's upon your attitude. If you want to charge for it, charge for it. The patient's not going to be using those pictures anyways. So it's nothing like the you're doing it for the patient. So the attitude is somewhere wrong. In fact, if you're using a phone, it's going to be taking a long time to document your cases because with a DSLR, you can easily get a good picture in less than 3 seconds. And I don't think that's called spending a lot of time. Very honestly, 3 seconds is not a good time. In fact, I earn more when I take good pictures because um, I'll just give you a very simple example. Although the patient has come to me for a pain in, say, 1/6 region where I'm going to be planning a root canal, I take a picture of the entire quadrant, and maybe there is some amount of stains in the palatal side of that particular tooth, or a couple of teeth in the palatal side, which typically is there, right? So they see a lot of stains, and then the patient is going to be asking you as to how to get rid of that stain. So then the patient is going to readily agree upon for scaling as well, which he never planned to. So you don't actually have to convince the patient for any more treatment. If the patient is seeing that something is wrong, and I'm sure you're going to be leveraging more dentistry out of one particular patient itself. So that's going to be reflecting on your finances immediately. When they say different problems with their teeth, they are going to ask you if you can do something for them. So I definitely don't think of dental photography as charging to the patient because I'm doing it so that I can improve my work and share it with my colleagues and stuff and publish. I think once they start doing great cases after looking back onto their work, and when they see their work improving, I'm sure everybody is going to increase the cost of the composite filling that they do after seeing the pictures and improving, right? So I'm sure if you charge for a composite restoration like 2000 right now, if you see your pictures and improve upon them, I'm sure you're going to be charging around 3.5. That
Yeah,
kind of takes care of it. We cannot look at every equipment in our clinic as something for an ROI.
yeah.
It's something for self satisfaction as well.
True. I think it is. It has to maybe for many things. So even for YouTube channel or podcast, we are all self
Obviously.
motivated to do, and whatever
Yeah,
you have to benefit, it will come along the way rather than you
yeah,
start
and
expecting.
obviously I use my camera as an outdoor thing also, right? I'm just not going to be keeping it in the clinic only. I'll be taking
Yeah.
it for outdoor photography as well.
Yeah, sir.
So,
Here I want to know one more thing. I'm sure you are quite busy, but uh, how do you find time to do outdoor photography and then do dental photography document? How do you balance? I'm just asking
mhm.
you as a normal
Okay,
person, how should he be able to balance the time, this hobby of dental photography? How do you manage it?
okay, okay. So very honestly, I have to confess that I've not been doing outdoor photography for quite some time, which I was in the past. So I used to invest a lot of time in wildlife photography before, but now a lot of my time is going into teaching, so that's the only reason why I'm not doing outdoor photography. But I love outdoor photography. Weekends are something that are really used were fixed for outdoor photography. Basically my suggestion for few people who find it difficult to balance is just keep the weekends for something that you like to do, and choose a location which is very close for you to go, and that could be within inside your house itself. There could be many videos that you can watch on YouTube, and they speak about different simple techniques that you can use in house also. So even an in-house window lighting system for taking a good picture would make me very happy. Even that does not require me going outside. In fact, that's what I did for most of the lockdown that actually happened. I'm sure we spent a lot of time indoors, and it actually gave me a lot of time to explore how I can use window light for different pictures. And that's also outdoor photography for me. I mean, outdoor in the sense not non-dental photography. So you just choose a location which is very close, that'll kind of sort out the issue.
So where do you see, I'm sure that 5 years, 10 years, you had a vision of dental photography, but I personally, I don't know. But today I see that maybe in another 5, 10 years, I can say that maybe the dental college education, especially the theory classes, should be shifted online. That I do feel we move in that direction, and you might have visioned that dental photography will evolve so much maybe long back, 12 years, 10 years before. In next 10, 15 years, what do you think will be a major change in this dental photography?
Okay. Since I started teaching dental photography, very honestly, I had very little encouragement. In fact, most of the people were apprehensive about learning dental photography. So the perception that most of the people have, that it was very easy and like a piece of cake for me to pick up dental photography and start teaching, is actually wrong. Because out of the so many years that I spent in teaching dental photography, I have to tell you that most of the time, 70% of the time went into convincing the dentist that dental photography was important. um, I mean, that's the psychology, unfortunately, only in our country. Whereas in most of the other countries, people know the importance of documentation. Maybe because documentation was covered during their studies, and a lot of teachers already told them that documentation was important. I don't know what the reason was for that, but I'm telling you that 70% of my time and energy went into encouraging the dentist to take up dental photography. So it's after encouraging them for so many years, I see them now understanding, and a lot of people now wanting to learn dental photography. But even now, when I do a bulk session where 200 or 300 dentists are there, I have to tell you or confess that a major part of my session is to encourage them that dental photography is important and DSLRs are very simple to use and very quick. Coming to how I foresee in future where dental photography will be, is yes, a lot of the education is going to go online. In fact, i uh, I have just launched on 17th of February, that's my birthday, my dental photography course online, which is there on teachable.com, which is an exclusive course. And anybody who wants to learn dental photography, who could not actually meet me personally, can actually go to teachable and learn the entire dental photography process online. And the videos over there are like the way you said, it's almost like it's very interactive, and it feels as if you're right in front of me, or I'm right in front of you and teaching you personally. That's the kind of effort that I've taken, and I'm sure this is going to be the future. As more and more education is going to go online, you'll have a more personalized feeling of the lectures, that somebody's teaching you online, but they you actually feel that they are right in front of you. The best thing that I find about online education is the liberty to watch the sessions whenever you want to. And
Yeah,
that could be
yeah.
lying on my bed, just maybe
And
before
watch it
dozing off. I
repeatedly.
probably want,
Watch it
yeah, and
repeatedly
watch
till
it
you
as many
understand.
times as you want at your convenience. And if you don't understand, you can rewind it, which you obviously cannot do it in front of a live session.
True, true.
So obviously, it has a lot of advantages. It has a lot of disadvantages also, which I've tried to overcome. For example, most of the people feel that they'll not have that actual feel of learning dental photography, which I've personally taken care that you actually feel that the entire process actually happening in front of you live. I've tried to keep all the things real. I've actually made mistakes and shown them that these kind of mistakes are going to happen. So the future, like you said, I think it's a lot of education is going to go online. And one more thing that I hope happens is that dental photography has to go into our formal education system somehow. But yeah, I mean, that depends upon higher authorities like DCI or even IDA, or maybe college groups or something like that, to understand that documentation is important, which I feel that people who are in authority level, maybe they are seniors and they still need to figure out that dental photography is important. But I'm sure in a lot of colleges, people have understood. For example, Manipal College of Dental Sciences, where I do the longest running program on dental photography in the world, not in India, but in the world. It is like a 3-month program spread over a span of 3 months, which is the most elaborate course, and it's just fantastic. I'm super proud that the world's longest running program is in our country, but a lot of people don't know about it. So obviously, it's going to take some time to reach that level. And I'm sure even in your college, I'm not really sure if people know Dr. Suresh Shenvi is from KLE, and I'm sure dental photography is really popular in your college, and a lot of people, especially in ortho, are pursuing it so very well. And that's the kind of attitude that we need to have for dental photography as well, because ultimately, if people see their mistakes only, they're going to be improving. And we need more teachers like you who are more proactive in the way they are teaching. So you're not only teaching in your college, you're very proactive in YouTube. And a lot of youngsters, in fact, if you see, I'm sure if you've seen your own YouTube statistics, The age group of 25 to 34 is the maximum crowd that's always online, and those are the kind of people who are your students. um, and I think that age group is going to remain constant, and more people are going to go and watch YouTube. And a lot of dental education is already there, but it's going to be more so in future. So online is a very big thing, and I hope so podcast also becomes like that one day in our country.
So, one last question. I'm sure those who watch this podcast will feel inspired to start with the dental photography. What
Mhm.
is your message? What is your concluding message to them in this podcast?
Okay, so the concluding thing would be, do not underestimate dental photography, very honestly, because it'll really help you evolve. Because the things that you can do with dental photography is improve yourself, share your cases with your colleagues, share your cases on Facebook. There'll be a lot of people who would probably want to point out mistakes. In other words, they'll be looking for to screw you, but take it in a positive way and learn out of it rather than feeling bad. Trust me, it's one of the best ways to learn. Don't be very apprehensive of showing your mistakes also online. There'll be a lot of people who'll actually genuinely tell you the way to go about it, I'm sure. There'll be a lot of people who'll put you down, but you need to, just come back on to your feet, and then you need to take it positively and learn out of it. You can also share your pictures with your staff, and I'm sure when you take a good picture of your inlay, onlay, or whatever tooth preparation that you've done, I'm sure I mean, especially during the pandemic, I'm sure when the college actually started, people or the staff actually told their students to WhatsApp or email the pictures to them. And I see that as a frequent thing that's going to happen in the future. But for that, you require good documentation to show how you've actually done your particular work. You need to record your pictures nicely. And I'm very sure even your patients, irrespective if you're a private practitioner or a dentist, a dental student, I'm sorry, your patients are also going to appreciate if you have a record of what you've done inside their mouth, and just be courteous enough to email it to them. And that's kind of actually going to change the entire equation, and the patient's going to be much more happy. The patients are going to be respecting you more and more for your work that you've done. Dental photography has more than 50 applications in dentistry, and um, it has applications in publications, forensic odontology, and I'm sure. So one very important thing that I probably want to share with students is that whenever you go out after graduation, if you want to start up your work, a lot of people are going to be asking you what was the kind of work that you did in college, and they would probably want to see that work, right? So I'm sure the x-rays are going to be helpful, so you're going to be showing the x-rays to the person whom you want to join. But they'll also ask you what kind of restorations that you've done. Is your work good enough? And you'll say, yeah, it was good. But how do they believe that you were good? The only way to convince them that you were good is showing them the kind of work that you did during your graduation days or during your post graduation days. And I'm sure once you show it, they'll be very happy to pay you according to the kind of work that you showed them. So I'm sure for PG students, we have something called as like a photo album or something, like a journal of cases that they have done. I'm sure you're a PG guide. I never did post graduation, but I'm sure you encourage your PG students to keep a record of whatever they are doing. So that kind of a journal is going to be helpful for undergraduate students as well. Maybe if they want to find some work outside, just keep on documenting everything that you do, irrespective if it's good or bad.
Sure, sir. So once again, I want to thank you for your valuable time, and you have given us so much of inspiration and so much of knowledge. I'm sure that someone who watches this podcast, they will really find a lot of information to start with dental photography.
Hmm.
And my viewers, please, I request you to visit Sir's channel. I'm sure he is on Instagram, he's on Facebook. He has special pages for dental photography and the 32 minutes podcast channel, and I'm sure that all those things will really help you and inspire you in this journey of beautiful dentistry. I thank you once again, Dr. Mayur, and hope to see you here in Belgium to learn more of dental photography personally and visit you in the next conferences. Thank you so
I'll be
much,
looking
sir.
forward to see you. Maybe we can be roommates again in some other conference in future.
Sure, sir.
It was really nice to be on your show.
Welcome, sir.
I'm used to saying it was really nice to have you on the show because I've been interviewing so many people, but
Yeah, yeah,
this time I'm on the other side. But it's
yes,
really nice to be on
yes.
the show and be on the other end, and I'm hopeful that a lot of people kind of pick up dental photography, they can just go to dentalphotographyschool.in, it's not .com, and check out all the blogs, or www.32minute.com. Check out all the podcasts over there.
Dear viewers, I will see you once again with one more podcast very soon on Aspire 32. Bye for now.